Hi, I'm Carla Graham and I'm a clinical nurse leader here at St. Paul's Hospital in Vancouver, BC. And these are your top 5 tips for perioperative nursing students in the scrub nurse role. Tip number 1. Tip 1 is handling power equipment safely. Always handle your power equipment with the equipment in the safe mode. This means that when it's being handed up or handed back to your table, you should always have it in safe mode. When you're getting ready to hand it to the surgeon, that's when you can flick it into power on and have it ready to go. When they hand it back, the expectation is that they hand it back to you back in safe mode. So it's safe for you to put back on your table. Some tips for handling the power when you're handing it up to surgeon is you can hold it from the bottom, you can hold it from the top on the handpiece, or you can hold it from both. Just make sure your hand's not in the way of where the surgeon's going to grab the handpiece. Tip number 2, passing instruments. Make sure when you're passing instruments up to the surgical team that you're passing them in the way that they're going to get used in the field. Also, make sure when you're passing the instrument into their hand, you give it a firm tap to make sure they know that it's there and ready to go. It's important to hand your instruments up in the correct manner so that it's ready to use for the surgeon. Handing it up the wrong way could poke the surgeon or would cause them some inefficiencies in having to spin it around to the correct orientation for use.
Moist.
Tip number 3 is using a neutral zone. Always have a pan on your back table with a green towel inside or something similar that you can use to pass up your sharps, such as your blade or your sutures. That way you have a safe way to hand it to the surgeon and you have a safe way to receive it back without actually physically handling the blade. On some occasions, the surgeon might be concentrating and might require you to hand the blade directly into their hand. Again, use the neutral zone to get close, hand the blade with your hand above and not below, and then when you're receiving it back, have the neutral zone ready to accept the blade instead of your own hand. Tip number 4 is suture handling. Make sure when you're using your sutures or passing them to the surgeon that they're using your neutral zone, or you're passing them by hand very carefully, keeping track of the tail to pass it off to the surgeon so it doesn't drop below the level of the sterile field. Same thing when you're handing it back. You can receive it back safely protected in the needle driver. You can use your neutral zone, and again, keep track of the tail so it doesn't fall off of your table. Tip number 5 is being engaged. That means being engaged in the surgery and what's going on. Really paying attention to what the surgeon's doing, how they're using their instruments, and that helps you anticipate what might come next. As well, this might give you an opportunity to learn what's going on with the surgery. You might have an opportunity to ask some questions, and they might do some teaching if they have some time. That's great learning for you, and it helps you next time do a better job at anticipating what their needs are.
Hi, Carla.
Hi.
What the hell's going on here?
We're operating. Get out of here. Get a mask on.